So welcome. We're excited to have you all here today. My name is Josie Lake, and I'm the Interim Program Partnership Manager at GEO Nova Scotia. We're here to explore a topic that's becoming increasingly vital, and that's digital access and mental health. Before we get started, just a reminder that we are going to be doing the draws for the door prizes. So you've got QR codes on the pillars around the room. Making sure that you scan, of course, to sign in to each different session that you're attending. If you're joining us on Zoom today, don't worry that you'll be automatically entered using your email and information that you signed into the forum with. So let's get started. A little bit of backstory. In 2024, GEO Nova Scotia added mobile phones and phone plans to our programming. Since then, we've distributed roughly 1,500 smartphones and phone plans to people who cannot otherwise afford them. And back in January, we started printing out our eMental health booklets and including them with every smartphone that we distributed. The booklet contains descriptions of all different kinds of mental health apps that are made free by the province, along with other helpful information. We've gotten lots of feedback because, of course, we do love our feedback at GEO. So we've put out some inquiries, and lots of our partners have volunteered their input on these booklets. And it has been so beneficial in helping us decide sort of what the next steps are going to be for improvements and different versions that we may need to think about trying to roll out. So there's also, of course, a QR code that will allow you to provide some feedback. And we're going to have some time today in this session where you can just write right on your booklet. If you have suggestions, leave it on your chair. We're going to collect them and review them as we start moving forward. So you notice that I have two lovely guests with me who are friends of GEO and experts in mental health. So they've come with us to have a look at the booklet and offer us some valuable input and insight around mental health and ways that we can be ensuring that our mental health is looked at through digital inclusion. So we're going to start with Jennifer. Why don't you just introduce yourself and give us a little bit about who you are and what it is that you do. Yeah.
Is that too loud? I'm Jennifer. I go by Jen Davy. By trade, I'm a registered nurse, and I worked at Nova Scotia Health for 16 years in critical care, and then I transitioned to mental health. And now I'm the manager of Connections in Dartmouth, and that is a service that we provide recovery and integration support for people living with severe and persistent mental illness living in the community. So we have a multidisciplinary team. Nurses, occupational therapists, recreation therapists, social workers, and they carry a caseload of folks who they support in the community to live what they identify as their best lives in the community.
Sure, I'm on. Wonderful, thank you. And Norma, would you like to introduce yourself?
Sure. So my name is Norma Lewis, and I am the health service manager of Connections in Halifax and Sackville. So there's three kind of sister programs. Our mandate is the same essentially as Connections Dartmouth, just serving a different geographical area. And I'm an occupational therapist by background, but I've been working in mental health and addictions now for 26 years. And as a manager for the last, 10 or 13 years, something like that.
Just for a minute, it's amazing how time flies. Well, thank you both so much for being here. We really appreciate all the insight and input that we've been gaining from you folks over the past few months. This isn't the first time that we've had some great conversation around this topic. And so, of course, the booklet's success highlights a real demand for mobile-friendly mental health resources. From your perspective, what are some of the biggest challenges and opportunities that using digital tools and supporting mental health?
One thing over the past several years, especially since the pandemic, we know there has been an increase in investment in e-mental health resources from the government and an increase in a need for them. Part of the challenge, and we see this with our client population often, is that they have their own challenges when it comes to social determinants of health. So things like they may not have housing or a place to set up internet, for example. Economically, they don't have the funds to be able to afford buying like a tablet or a phone. Housing, like I said, education, even knowing how to to use the phone and to set it up. So because of that, we've really, that's when we kind of connected with you folks at GEO, just to recognize that there is a need and you provide that opportunity to help with inclusivity when it comes to everyone getting online digitally, and so and you help provide some of these folks with getting devices. So we really have been following you and interested in what you provide for a couple of years at least.
Wonderful. Thank you so much. Norma, did you have anything you want to add, or anything that you're seeing different as far as challenges and opportunities?
I would say those are the big ones for a lot of our folks. And more, our world is shifting to a digitally based world. And so a lot of our clients are being left behind because they don't have access to the funds, to purchase devices, if they have the funds to get the device, or if they have a device given to them, they don't have the ability to maintain the connectivity. Mm-hmm. And so whether it's a cellular plan or whether it's the internet, people really struggle. And so during the pandemic, I think the Mental Health and Addictions Program recognized that this was a huge barrier, and there was a period of time where we had a program called Staying Connected, and so devices were being provided during COVID because so many of our services were switching to online when possible. But that ended with COVID after a few years, and so it left a gap. And so GEO's been great in terms of helping to fill that gap.
One of the things that we've kind of been hearing periodically throughout well, not even periodically, continuously throughout the day already so far, is that need for, skills building and ongoing support. And then when we're talking along with mental health, I mean, that has so many different approaches to it, and there's so many different barriers and ways that we can assist and ensure that people are even able to use the apps that we've included in the booklet. So taking a few minutes now, we're going to put you folks to work. So if everyone has a copy of the booklet, or if you can find a copy, if you don't have one and you want one, put up your hand. Kamal can come around and get you one. We're going to invite you to sort of have a walk through the book. We're going to look through it together as well. Again, make some notes and some suggestions. Of course, we are not able to always stay on top of all of the best apps and the tools that are out there, so we always welcome any suggestions as well. So looking through the booklet, we will note there might be one, not probably, there could be one typo in the book. Get a bonus point. If you find the typo, you can scan the QR code twice. I don't know. So there's a little welcome to the beginning of the pocket guide, and then ensuring that people kind of know, again, that these are included in our smartphones that we're delivering. One nice thing is that we've had partners reaching out to us saying, hey, this is a great tool, and asking if they could get a few copies to provide outside of having to give out the device. We're going to talk a little bit more about that, but we are going to be partnering and making some of these copies available so that it's not just within the device. Early on, we identified, of course, these tools are not going to be useful if someone doesn't know how to scan a QR code. So we did include some direction on how to scan a QR code. And of course, we've got a little bit of recognition to Nova Scotia eMental Health. Foundation, who made this booklet possible. I will admit, I don't know all of the apps within the booklet. I have not had the opportunity to look through them all, but I am familiar with some of them. Mindwell is a platform that provides users with access to self-help and mindfulness. So it's a great tool for people to sort of identify what do they need to kind of recharge, to regroup. And it has lots of tools within it that you can kind of set up your own programming, which is a nice way. You can go into one app and find those resources that you need. I'm not sure how familiar, either of you familiar with Mindwell, had the opportunity to look through it at all?
Mindwell is not one that I'm familiar with. When we get to Together All is probably the one that I'm
All right,
most
give us a
familiar
little
with.
bit about Together All.
Yeah, so Together All is a platform that the Nova Scotia government pays for, and it's offered in partnership with Nova Scotia Health, the Mental Health and Addictions Program. And so I think the literature over the last many, many years has spoken to the value of peer support in helping people manage mental health challenges, staying well from a mental health perspective, and also managing mental illness. And so Together All is a platform that utilizes peer support. So people can go in and create an account, and it's sort of a peer support platform. One thing that I like about Together All is sometimes an online peer platform can, when people are making posts, things can maybe go a bit sideways. Or people, if they're in a lot of distress, may be reaching out in situations of crisis. So the thing about Together All is there are actually paid, trained peer supporters who monitor the discussions that happen, and they're able to kind of moderate the discussion on the platform. And they're also, if someone posts something that indicates that they are at imminent risk, there is a way that they can access through the IP address and take steps to try to reach out to that individual to make sure that they get supports that they need. So that's one thing that I like about Together All compared to some other peer support type platforms, is there is a little bit of a safety net built into it.
Yeah, and that's really great. And a part of the booklet as well is, we are aware that, some of that feedback that folks can get when they're in social media apps or any app can be a barrier to them even wanting to participate. So we have included things like the number for Kids Help Phone and some other valuable phone numbers within the booklet as well. So it's not relying solely on apps. There is some information in there to allow folks to still call the old-fashioned way, pick up a phone and make a phone call.
I just wanted to speak to that. So I was
Sure.
going to say, so that's what I love is so often if we have people present to our service looking for help and not knowing where to go, there is a central intake line that people can call, and it is an intake service. So someone can call, they'll gather their information, and then they try to treatment match somebody. And that number is in the booklet, and also the number for mobile crisis. So if someone's in crisis, the phone number for that. I love that. Yeah.
Good.
Yeah.
And if I can add to that as well, Jen, is, there are different levels of need when it comes to mental health. Some people may not meet the threshold for an actual, bona fide mental illness, and they may not require treatment. And they may not need to become a mental health patient as part of the formal mental health and addictions program. However, they still require support. And so these apps in the mental health program, we refer to it as a tiered system. So tiers 1 and 2 are meant to be sort of community-based supports for people experiencing mental health challenges and challenges that could impact a person's mental health. Tiers 3, 4, and 5 are services that are provided within the formal mental health and addictions program. And so these resources can be available to anyone, no matter, if you're experiencing a diagnosable illness, if you're someone who's struggling to cope whatever the issues might be, these apps are there and available to Nova Scotians.
Yeah. And again, so you not to ever say that these apps should replace reaching out to a professional if you feel that you need mental health support. These are just tools that we can use to aid in your journey towards mental health. That said, of course, we've already invited you folks to write and include any notes that you have for improvements in our booklet. Jen and Norma, did you have anything that was glaringly obvious you thought that we should be including? If not, maybe we'll open it up for a couple of questions.
I think it's great.
I don't know how time went so fast, but we're ticking down on our time for the session. So was there any chat questions? Do we know? I don't see any.
No.
Did anyone in the audience have any questions that they wanted to ask about the booklet or suggestions? I'm going to have to come right to you, Mary, because Kamal's going to bring the mic to you. They can't hear you online if we don't have a mic.
Thank you. I don't really have a question. I'm just thinking, I'm leafing through this and, you know, going into their apps, and it would be so amazing to have more of them. I know that's something that you're working on, but I just said to, I almost called her Josie, my Josie over here, my new Josie, how many people could benefit from it and how easy it is just to, there it is. And no one, and I think, you know, the QR code system provides that anonymity that people are really seeking, because no one, you know, in the booklet, it's like 1 in 5 have mental health issues, but 5 in 5 have mental health. I love that. But no one wants to be that one person to stick their hand up. So this is amazing. So if you could make these available, I'd take 100.
100%. And if I can say kudos to GEO for recognizing the need for this, because there's been so much investment by the government to make these platforms available, but if people aren't aware of them, they're not going to get used. And so having a simple little tool like this available together with the phone or the device is huge. But also, we were saying to Josie, we want to have copies of these in our offices, because even within the mental health and addictions program, there's times that we have to say, oh gosh, what was that app again? And you have to kind of go looking to find the information. So to have it in one place with really easy to understand descriptions of what each app is, with the QR codes, and then the mobile crisis number there, and the referral number for central intake, it really is quite something. So, you know, kudos.
But wait, it doesn't end there. So we're very excited to say that we've acquired some funding. So again, we are going to look at, this is why we're reaching out. We're really hoping folks to offer suggestions on great apps, great information, things that you feel people need to see within this booklet. We're also looking at making sure that it's available in alternate languages. Because we do recognize that we need more than just English availability. And then we are going to be able to make more copies so that it will be available more than just within the devices. We'll be able to provide, for now, some partners additional copies that you could have within your locations and your organizations to give out to folks. Of course, there's always the PDF e-version as well. While it's not necessarily as handy as having a little booklet in your hand, there are some folks that may prefer that. Any other questions?
Yeah, I think we do have one question here.
Not so much a question as a comment. This is absolutely lovely, and I know that in the sector that we work in, which is with folks experiencing housing insecurity and homelessness, these resources can feel really daunting for them to reach out to, especially calling an intake line and like going through that question process. Once I scanned them and was looking through it, like it's really user friendly, and I'm not tech savvy, so it's I think it's really great, and I'm looking forward to seeing how we can utilize this to reach folks who are sleeping rough specifically, because they don't really reach out for support in your typical ways, and it can take a long time before they're feeling comfortable to do that. And I feel like this lets them do it in a very private, anonymous way if they choose to. So good job.
Sadly, there's still a lot of stigma in our world.
I just
Hello.
wanted to say, oh, sorry. I just wanted to say one thing. I was going to say it's interesting that you said that, because you're right there, both of you. There are a lot of folks who feel like they need help, but it's so daunting to think about picking up the phone. I know my own grown children won't do that. So that's a really good point. Thank you for that. Sorry.
Hello, my name is Leila. Thank you so much. I'm from CSAP, Conseil Scolaire Acadien Provincial. I would like to know if it's possible to get a French version for this.
We're working on that.
Yeah, soon. So that was one of the big things that we identified a need for, was to have a French version. So again, we've been very excited to say that we have already acquired some funding that we're going to look towards ensuring that we have a French version. So anybody who would like to assist to ensure that that translation happens accurately and precisely, we're certainly welcome. We have some French teammates, but we're always open to collaboration and partnership with everyone. You've heard the term stone soup today, and we really do live by it. So if anybody is interested in becoming more involved with the booklet process, by all means, we welcome you to reach out to us, GEO, whether that's from language or apps. French will probably be the first obvious alternate language that we would look at, but we're hoping that we'll be able to figure out ways to make sure that it's available in multiple languages.
Thank you so much.
Great. Did anyone else have any other questions before we wrap up? Was there anything online? Do we know?
Just people wondering
it's kind
where
of
they
amazing
can-
how fast 25 minutes can fly by. I feel like we just sat down. So thank you again, Jen, Norma, for joining us, and for all the wise advice and input that you've provided us over the last little while in trying to put this together. To all of our partners who've had a contributing hand in trying to determine. One of the things that was the hardest thing was there's so many wonderful apps and tools out there that can be of assistance to folks. So it was, trying to figure out what to put in the booklet first. This is just the beginning of the booklet. We do have to keep in mind that it should fit inside a phone box, so we don't want it to be too big and too encumbersome, but we do welcome your feedback. So please leave those booklets on the chairs if you have any suggestions. Reminder again to scan the QR codes to get entered into our door prizes. And I guess, so thank you again. Yes. Thanks, everyone.